It's great to connect wherever you are. I'm Yusuf, the co-founder and CEO at Quit Genius. So I want to start by questioning who you picture when you think of an addict. Is it, for instance, this rough-looking male who looks like perhaps he doesn't take super good care of himself? You know, he might be caught with a cigarette in his hand, works at the local manufacturing plant, maybe a construction site, and is perhaps known to hit the bar every night, only to do it again in the future. The reality is that many people just don't conform to that stereotype. So let's take, for instance, a salesperson who's now an opioid addict. He got hurt running his 4th marathon. He had surgery just as lockdown was starting to begin. He was prescribed a month of opioid-based painkillers, which he left in his cupboard. But then when the pandemic hit and his commission evaporated overnight, he found himself turning back to those pills. Or what about the overwhelmed professional mum who's trying her best to work remotely while also doing at-home learning? Unfortunately, something that's all too common these days. And to cope with that struggle, at night she has a couple of glasses of wine, maybe a bottle, sometimes even more. Unfortunately, the behaviors that I'm describing can very much become the addictions of tomorrow. And unfortunately, once again, addictions are on the rise and they're not going away by themselves. So if you read through some of today's headlines, you're going to kind of see some really scary stuff, such as the pandemic within the pandemic, cigarette smoking making a comeback, stress drinking, 40% of US adults struggling with mental health and substance abuse, and the fact that overdoses are now up a shocking 30%. The trends in comorbidities of addiction are also incredibly frightening. So many people don't actually realize that 70% of people with an alcohol use disorder, for instance, are also smoking cigarettes. And the result is that these multiple substances have become one of the most significant drivers of overall medical spend. And these numbers that you're seeing over here don't even take into account the raft of other challenges, everything from safety hazards to productivity issues, which vary again by industry. So the good news is that we know that there are super effective strategies that are designed to really help people deal with addiction. So leading global health organizations already recommend a combination therapy approach of high intensity behavioral therapy in conjunction with psychological habit management, and also recognizing the social support that's required. And collectively that's known as medication assisted treatment. Unfortunately, we're facing an access problem where very few practitioners are actually able, or very few people who need it are actually able to access the type of care that they need. And that's really where Quit Genius comes in. So we work with employers and health plans to deliver the world's first technology-enabled digital clinic for multiple addictions. That member journey starts with a very targeted communication campaign that's really designed to destigmatize the entire topic of addiction and remove barriers from accessing care. And then from there, we guide members through our Addiction Care Navigator, which is really designed to help identify where people fall on the addiction spectrum and enroll them in the most suitable treatment program offered by their employer. That's often going to start with Quit Genius, but our Care Navigator is actually going to integrate with other programs from an EAP to an in-network healthcare provider to refer people to programs that are at the suitable level for them. So we're not trying to solve this problem with technology alone. People like Danielle, who you'll see on the screen over here, require a dedicated physician-led care team with a virtual medication-assisted treatment experience that delivers that evidence-based care directly for them. And the way that the Quit Genius program is designed is to be that holistic digital clinic. So her physician is going to be able to conduct that telemedicine visit, allowing them to prescribe appropriate medications, monitor adherence, deliver effective craving support. And then on the therapy side, she's going to have a board certified behavioral therapist that's really delivering the CBT, as well as the relapse prevention tools and anonymous peer support. The great thing is that we've actually proven these clinical outcomes. As a physician-led organization, we care deeply about clinical results, and we've built the best-in-class program with a randomized controlled trial that actually proves our results in the wild. Now, when I founded Quit Genius 3 years ago, it was really because of that deep-seated frustration that I felt myself on a daily basis with a toolkit that just hadn't evolved at all in decades. At Quit Genius, our mission is really to help 100 million people overcome their addiction. This approach has been validated by 6 peer-reviewed studies and a randomized controlled trial. So to summarize, really, we're super excited to be on this mission. We've helped 60,000 people quit their addiction to date, but we still have a long way to go. If you're an employer or a health plan or part of any other healthcare organization and this resonates with you, perhaps you know somebody who's been through some of these challenges, then feel free to reach out. Thank you very much.
Thank you, Yusuf. Great job. Attendees, please put your questions in the chat, and I'm happy to kick off. Curious, Yusuf, how you overcome the barrier of people being reluctant to share such personal challenges as addiction with their employers or even their health plans for fear of repercussions of various kinds.
Yeah, that's a great question, actually, because all the research we've done suggests that people aren't going to engage in care if they think that there's a chance that that could get back to their employer and be used against them in the future. And that's frankly something that employers don't want themselves either. So we're very clear that we protect confidentiality throughout the entire process. At no point is personally identifiable data around a person's addiction or their struggles ever sent back to that employer. So we maintain total confidentiality. The only reporting we do with employers is on an aggregated and anonymized basis. And then from there, it's really around destigmatizing the topic of addiction. So it's using the correct language to help reframe it as a chronic brain disease rather than just a willpower issue. We know genetics plays a big component, and just making sure it's really easily accessible for everybody.
That makes a lot of sense. Very helpful. Esther Dyson, can you come off mute and ask your questions? I see you have a couple. Feel free to fire away.
Yeah, sure. I'm curious what impelled you to start the company, what you did before, just a little origin. And second, who are some of your clients? Where do you operate? Just a little more sense of the demographics almost. Thank you.
Absolutely, great question. So, so tackling the first question, actually, while I leave this on the screen, is my own background is actually as a practicing physician myself. So I qualified in the UK, and unfortunately, I would see kind of, so to speak, like the challenges of people struggling with addiction on a regular basis coming into my clinic and the so-called repeat customers. So we built a healthcare system that's great at helping solve acute problems, and we patch them up and send them back out there, but we're not solving the deep-seated behavior change that is required to really get people addiction-free in the first place. So it was born of that frustration. We did a lot of research. We realized that the tools at the time were either very low tech, and they were relying on really face-to-face therapy and old models of care. All the high-tech stuff just wasn't evidence-based. To date, we've scaled across industries. So we're now working primarily in the US, but we also work with the NHS in the UK. And it's across, a range of, so this is kind of a few of our clients, from technology to construction to mining to manufacturing to retail to hospitality, and increasingly we're working with regional and national health plans across the US as well.
Thank you.
Thanks, Esther. Roberto Reutz from Humana, can you come off of mute and ask your question, please?
Yeah, sorry. Great presentation. Appreciate it. I'm just curious. Do you have any results, outcomes specifically in the Medicare space?
Was that in the Medicare space you were asking?
Yeah, Medicare space.
Yeah, so we're currently in talks with a number of Medicare plans. We haven't actually worked specifically with Medicare yet. We have worked with Medicaid in the state of Alabama, and that's something that we continue to expand on. From a clinical outcome perspective, we don't expect the actual clinical outcomes to be much different, based on the business line. So today we're working primarily with health plans on the commercial and ASO arms of the business, and now expanding into government plans. But generally across our book of business, we see the same quit rates that we've seen in our randomized control trials.